Hello, ma'am.
Thank you, all of you, for the question, Living. Thanks for the Ayurveda map. Shall I stop,
Yes, ma'am. Yes, ma'am.
Dr. Radhika? I
Yes,
want
yes.
1 minute. 1 minute.
Yeah, yeah, yes, ma'am. Thank you, ma'am. From on behalf of Ayurveda Map and myself for explaining each and every part of orthopedics and also for extending your practical knowledge, sharing your practical knowledge to us. Thank you, ma'am. Ma'am, with your permission, can we go for the question answer questions? There are
Okay,
questions.
okay. Ready.
Okay. Ma'am, which kashaya can we use other than Marmanadi kashaya?
In Thiruvananthapuram Ayurveda College, where I have studied, they are using Thannundaram Kashayam with the Mustadi Marma Kashayam. Thannundaram Kashayam alone can be used.
Okay, okay. Ma'am, Latin or Sanskrit name of Chenninayagam they are asking. So I just
Actually, Chennanayagam is the pulp of aloe vera or Kanya Sara. Kanya Sara. In Punjabi and Hindi, Eleva.
okay. Ma'am, can you please explain the role of Rasnadi Talam and also please explain the Talam procedure because in North they are not using this treatment at all.
Actually, the talam was put in for the doctors outside Kerala for knowing about talam. We are using talam as purva karma in each and every Sweda conditions and to prevent scalp edema and for the relaxation of pain and for in numerous disorders like thyroid, etc. We are using talam. Talam is a type of Murtha Taila. Nimbamrdadi, as per Nimbamrdadi Talam, take a hot pan or a hot spoon, powers with 5 ml of Nimbamrdadi or as much needed, and Dasnadi Churnam or Kachuradi Churnam, as per the Doshik predominance, it is added and allowed to put, then put it at Dhammarandhra. This is the Talam for 1 hour. This is the method of application of Tala.
Okay, ma'am.
What it? What it?
Yes, 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 ma'am. Ma'am, when to use cold fermentation and hot fermentation? When to use oil and when to use lepa?
Oil and Vada predominance and Leba in slash majority, we are using Nimbo Sorasa or Cheranaringa Nide instead of this oil. And various Sorasa in bleeding, we are using Durva Sorasa. In bleeding, we are using Vasha Sorasa instead of oil. According to dosha predominance and Roga.
Okay.
Any doubt?
No, ma'am. Ma'am, when to use this cold fermentation and hot fermentation?
Please explain.
മാം തണുപ്പും ചൂടും എപ്പോഴാണ് വെക്കേണ്ടത് എന്നുള്ള കണ്ടീഷൻ
Pitta predominance, cold fermentation, and in Vata and Vata Kapha, hot
fermentation. Okay. Ma'am, can Nimbamridadi Thailam used internally or only externally?
Nimbamrita Adi Thailam can be used internally and externally. For Talam Nimbamrita for Talam Apingam, we are using Nimbamrita Thailam externally, and for getting purgation, we are using internally. Both internally and externally, it can be used.
Okay. There is a question, what is Kiri? Kiri is nothing but a potali.
Potali. I have neatly explained about making potali.
Yes, yes. Jambira Pindasveda you have.
Is it difficult to understand?
No, ma'am. No, ma'am. It is very good. Very nice. Ma'am, when a contusion happens, what is the treatment for contusions?
When contusion happens, first dhara, Dashamula dhara, Lekhu Panjamula dhara, dhara using dhanyamlam, dhara plus kupila or milk, these all can be used. Then for preventing hematoma formation, this Virabol and aloe is using. If it is not available, Gulguru Ksheerabaga is using. And Praleba, here Nagaradileba, either Kotanjikadileba. If it is a Pitta Pradhana and Tripaladileba or Lakshadileba, you can use according to Doshik predominance. Any more?
Okay, ma'am. Ma'am, what is this Hira ball alloy, or where will we get it?
It will be getting at this shops. Hira ball is described in our text. This Hira ball. Here Pancham and Parika, Meera are other another names for this Hira ball. It is very effective. It is easily getting in Punjab also.
Okay, okay. Ma'am, treatment of recurrent sprain, mostly back and calf.
Back and calf.
Ma'am, sound is little bit. Hello, ma'am.
Is occurring. We should tracking recurrent. What is the reason behind that in recurrent sprain? In the recurrent sprains, that Shastika Annaleva good for avoiding this current pain, but reason behind it can be found.
Okay, ma'am, there is a small
condyle deformity, patellar dislocation occurred, like any other deformity or any other causes. Dislocation occurred. Likewise, you have to probe for any underlying deformity or underlying cause, and for avoid strength as the treatment part is concerned, and to avoid recurrent sprain, Nyavarakiri is needed and strengthen the particular part where sprain occurs.
Okay, okay. Ma'am, next question. Nowadays, middle-aged patients suffering from bone fracture easily with vitamin D deficiency. What we can advise as daily supplement? Nowadays, we are not getting good food.
As daily supplement, you have to take Guluji Sattva or Giloya Khanavadi or Samsamanavadi plus Gendha Tailam. Or as dietary preparation, you can take goat soup or Mahisha Dravakam and try to wear white clothes always. And it is a sunrise vitamin, and proper Surya Teja is also needed.
Okay. Ma'am, in Apabahuga, what is to be used as Pratimarshanasya?
Dhanvantaram Avarti 721 101 can be used. Karpasastyadi Avarti can be used. And Prasaranyadi Maharaja Prasaranyadi Thailam can be used. In chronic conditions, Avapedaga Nasya, Swarasa is used. And for the first 2 or 3 days, Swarasa itself can be applied, and for the 5th and 7th day, then the oil mixed with the salsa can be instilled through nostril.
Okay.
That is good.
Ma'am, next question. Ma'am, in case of cervical spondylosis or spondylolisthesis, and also in lumbar cases, can you please give us an idea about how to treat it or how to understand it?
We can get diagnosis from radiological reports, then from testing SLR, then from testing these reflexes, and by clinical examination we can get the diagnosis. In case of underlying pathologies like piles also, and the retention of gas also has been incurred and ruled up. There is an experience. 2 months ago, a lady came with a limping gait, came to me in the OP along with his son, and there was extrusion and the disc herniation was there, and she was posted to surgery. The spinal canal diameter was 4.9 millimeter. Then the patient approached me to avoid surgical condition. Then I examined the patient. I thought that the gas retention and the belly, the pot belly, the large size of pot belly is the reason for this. And I gave only Padola Muladi Kashayam with the Shandana. For my surprise, I surprised that after 1 week, she walked to my OP without any pain or limping gait. That type of incidents are there. In case of this disc prolapse, I treated 4.9 millimeter up to 4.9 millimeter spinal canal dimension. We can treat most of the cases which has been posted for surgery. In herniation and extrusion, I am practicing Vamala, the Pradiloma Sodhan. It will help to reduce the disc bulge, and I am also giving this Hirabol and alloy for reduction of disc bulge, and I am also giving Dhanyamblam, 30 ml of Dhanyamblam. It is a Santana Kalpana mixed with the Saindava and what is that? Maricha powder twice daily for reduction. Usually, I am giving this Sahadiradi Kashayam and Dhanvantaram Kashayam. There was a doctor, actually he was an orthopedician, and the reflex was mute when he at the time of admission. Then I gave him Pulingiri and Kadivasti along with this Vasti and attained good result. What else you want to know?
Yes,
this is a separate chapter. I need another 1.5 hours to explain about my cases. A lot of cases was treated with me.
Okay, ma'am.
First thing, you have to avoid this malabandha, gas distension. Then treat for this disc bulge. These methods are very helpful. This Mamsarasam, Marmakanyi, this Dhanyamla Pana, then this Pulingiri. Pulingiri, I have described. You please take a 200 gram of this turmeric, chincha, turmeric no tamarind, chincha, and remove the seeds in, and add a 30 ml of oil, any medicated oil, and make into a paste. And then you have to apply this over the spinal area, which where bulge has been occurred. Then take this salt, not powdered salt, crystal form of salt. Then fry it for 2 minutes. A tap sound has been starting. Then tie it in a jute or jute sack, a piece of jute sack, and heat the heat over this pulley with this jute sack. After by practicing this pulling, you will get fantastic results. There are a lot of modalities like this pulling.
Okay, ma'am. Ma'am, next question. Can I go?
Yes.
Ma'am, a male patient with knee pain when bending the knee. The MRI suggests grade 1 chondrocomalic changes involving medial tibia femoral articulated cartilage and involving femoral reticular cartilage. Also suggesting of focal synovitis. How to treat in Ayurveda?
First, we can start with the Dashamuladhara and Lepana. After reducing the inflammatory condition, then a nourishing treatment like Patra Bodala Seda, Shashtiga Binda Seda, Shastigana Lebana can be practiced, and various Vasti can be practiced. After reducing this inflammatory condition, Mamsalasa can be given for preventing this type of this is a type of osteoarthritis, but it is an inflammatory condition also. That is that type of management can be administered.
Okay. Ma'am, medication course first, second, third given for how many days in each course? Because
See, when we are giving a medication, everyone has an aim. If this medication is practiced to reduce inflammation, you please continue till the inflammation is reduced. If this is to strengthen, if the medication is planned to strengthen the joint, still normalcy is attained, you please practice. If there is an elevated cholesterol level, I have been using this Mamsadesam twice in a month or once in a week, etc. You should be cautious about the underlying comorbidities also.
okay. Ma'am, after C-section, most of the ladies suffers back pain. Is it due to any nerve injury and how to manage?
After cesarean section, no, not due to the nerve damage, it may be due to a complication of this anesthesia, or it may be due to, in one case, I got after cesarean, I got there was a belly and there was vitamin D deficiencies there, disc bulge is also occurred, and they were not, they may not be using proper bandages. We advise proper bandages and continue with abdominal belt up to 6 months. Then there is no pain will occur.
Okay. Ma'am, in Marmakiri, what is named content named Ashali in Sanskrit?
Actually, I don't know the Sanskrit. I will search and answer
Sanskrit
through
is
WhatsApp.
Ashali, I guess.
It's a type of seed, a cumin seed variety, ashali. In traditional practice, it is used in kshadas.
Okay, ma'am, it is also known as organic grocery halim seeds. I searched in the net, that's why.
I don't know. I think it is included in Arivaga.
Ah, yes, yes. Okay. Ma'am, we'll go
I
to.
will search for the Sanskrit name.
Okay, ma'am.
Next question.
Snigdha Udvartana means Thailam mixed with Udvartana, ma'am.
Yes, yes, yes.
Okay.
Correct.
Ma'am,
Proper Thailam. Cotton chukadi. If snigdha and rukshada is needed in OA cases, ruksha uddatanam will always produce pain. Then oil mixed with this medicated powder is using for snigdha uddatanam. As soon as it is finished, then also steam is also giving. This type of practice will bring drastic relief to these OA patients. This is my practical experience, not according to textual practice.
Ma'am, how can we treat synovial cyst in knee joint?
Varanadi Kashaya, Trayandyadi Kashaya, and Kanchanara Gulguli.
Ma'am, how to use manda in Mamsakiri?
Manda means teli. Manda, method,
Usually
it is takra byproduct manda. I am not Mamsakiri. I am not practicing manda. Mutta. It is mutta. Egg yolk. After he cooking this egg yolk is removed. Then this egg yolk 3 or 4 egg yolks are fried with this this avanakanna, that castor oil or nimba oil till it is getting paga. After that, a piece of this asti sringala is also added. Pasted asti sringala or changalam paranda or hajju is added. Then these powders are added. Then making into a pottery and dipping in hot oil. This is the practice of marmakiri. This is mutta or egg yolk. अंडा के अंदर रहने वाला पीला रंगीला.
Okay, thank you so much, ma'am. Ma'am, next question. In pigeon chest of a 4-year child who is now having normal all investigations, what treatment should be adopt to manage the deformity?
pigeon shaped is just a pigeon shaped is just a. Then Induganda Kashaya and Desimulakatra Kashaya for Soda Sodana. After that, Genta Daila. After Shastikana, Levana should be practiced.
Ma'am, after accidental injury, some patients come with stab injury, blood clotted under his muscles. What treatment externally and it should be given?
Dhara is enough. Dhara is enough and more. Dhara for 7 days, 14 days. Dhara, Dhanyamla Dhara, Desimula Kashaya Dhara, and our Hidabol and aloe is enough and more. Or as a hemolytic agent, we can give Bulgulitikta Kashaya. Bulgulu is lacanine property. It can extensively used in this type of deep veins also. And it is a hemolytic agent. It can be used. Dhara is perfect.
Ma'am, after accidental injury, sorry, ma'am. Ma'am, please take one more lecture and request Ayurveda MAP organizers to arrange one lecture more.
About what? I'm taking one more lecture about Madharekta.
Okay, ma'am, sure. Ma'am, what we can use to increase height? In North uses alassi with cow milk.
I had a knowledge from Nirmananandagiri Maharaj. He once advised that video of Negrotha or the root hanging from the Negrotha as Shirabhaga, it can be used to increase. But there is no experience regarding this.
Okay. Ma'am, in osteoarthritis in age of 40 years with knee pain, what is the cause and how is the prognosis in Ayurveda?
What about her menstrual periods?
Dr. Sumaya, if you are there, please answer. Yes.
Hello,
Dr. Sumaya.
Yes, ma'am, it is a male patient.
Male patient. What is the reason? His food habits or the wear and tear?
No, no reason, no injury, no wear and tear, nothing. But he just had a menisci tear in one leg, but that leg is normal. Yeah, but that leg he underwent a surgery and it's okay, fine now. But the other knee has the osteoarthritic changes.
Probably he will be applying more pressure to the untreated leg or the leg which has not been undergone surgery. In these type of cases, bilateral legs has to be rejuvenated. You please please correct his metabolism and give nutrition foods like Kshirabhagam, give Mahadiktagam Kridam and Pravala Pishti and a Shastigana. Please do a Shastigana Lebna for bilateral legs. It will be okay.
Okay, thank you, ma'am.
Okay, ma'am. One last question, ma'am. A 70-year-old patient with history of bilateral shoulder dislocation happened after epilepsy. Done keyhole surgery to correct that. What can be done as an OP treatment? Not able to lift both arms.
In this particular case, start with Dashamula Thara. If the muscle wasting or stiffness of muscles is there, gently use Niktha Uddatanam, then hot fermentation. After that, after the muscles is relieved, you please start with Kashaya Dhara, Dashamulam or Shira Dhara. After that, Taila Dhara, then Shastigana Lebanam or Shastiga Pinda Seda, then it will be okay. Pradimasa Nasya can also be, Pradimasa or Marsha Nasya can be administered using Dhanvandaram 7, 21 or 101 according to the need.
Okay. Ma'am, we have one of our participants who wish to talk to you.
Yes.
Dr. Ujjwala, you can speak.
Okay. Good evening, ma'am.
Dr. Ujjwala, good evening. Nice to meet you.
Me too, ma'am. Very nice session, ma'am. I have a question. Ma'am, some patient goes to gym and they uses more treadmill. After that, actually, I have developed this once. After that, I started knee joint pain. So only means because of that vata chalaguna, because of that it is, na ma'am. So what will be the treatment for that? Only immobilization with what we can use internally.
Hello, ma'am.
This usage of treadmill should be started according to the physician's advice. 4.5 kilometer
Ma'am, voice is breaking, ma'am.
is advisable. Do not practice over 6 or 7. I don't know. That may be due to connection. Can you hear, Ujjala? Can you hear?
Yes,
Yes,
ma'am, it's
hello.
breaking in between. That sound is breaking, ma'am.
Hello, ma'am. Hello, ma'am.
Yes,
Ujjala.
ma'am. Hello, ma'am. Shall I
Hello.
repeat the question, ma'am?
Okay.
I have this treadmill, ma'am. Sometimes after doing so much of treadmill, that joint pain will start, knee joint pain mostly, and sometimes ankle
Okay.
joint
Okay.
swelling also a little bit, but not
Uh,
pain is more, not much swelling.
Dr. Ujjala, I wish to speak about the usage of treadmill itself. You have to use it with the advice of a physician himself. 4.5 is the actual feed, and don't go up to 6. And you please always practice wearing shoes. For this overuse may be the reason behind this pain. You please apply this Mahamasha Taila and Gandha Taila, and reduce the hours, and keep in practice in the speed between 4.5 and 6. That is optimum speed. That is my answer.
Okay, ma'am. Thank you so much. Internally, what we can use, ma'am? Nothing. Only external is enough.
Mamsarasa, Mamsarasa, Okrasu, Gandhadaila, or Gudgulurikta Krada, and Pravala Pishti. From these, you can select according to your need.
Oh, okay, ma'am. Ma'am,
Hello.
hello, hello,
Hello.
ma'am.
Hello.
You can hear me, ma'am?
Yes, Dr. Jala.
Yes, doctor. Please speak.
Ma'am, one more question I have. I have one patient. She has done too much of dancing. Then she had developed cramps in lower leg and both knee joint pain severe. Then she went to orthopedic. Though her X-ray was normal. Then I have thought about Vata Rakta condition. So I gave her Kokilaksha Kashaya and one more Laghu Panchamula Kashaya with Dugdha Siddha Laghu Panchamula Kashaya. So her left knee joint is reduced, but right uh, knee joint pain is still there, ma'am. It's been 1 month. So what we can do one more?
You please convert this kashaya into Shira Kashaya and give Gandhadaila and Abhinga, daily Abhinga for she herself can do 14 days with a Lakshadi Taila, Mahamasha Taila.
Yes,
Even if
Lakshadi Tela
Vadarikta
I have
symptoms are predominant, Pinda Taila can be advised. Pinda Taila can be advised.
ma'am,
Surely you will get cured.
ma'am, I have gave her 101 Kshira Bala capsule, ma'am.
One Shirabala capsule. What about her vitamin D levels and calcium levels and the intake of water levels?
That I have not checked, ma'am. But she used to take calcium tablet. But I told her not to take more calcium without checking any vitamin
It will
D.
precipitate.
That also I told her. So I
Upping,
told her to stop and start 101 Balatel. It will be helpful for her. So and planning to give her Gandhatel future.
as per Dr. Ujjala, the sofa has been reduced. Then please you please convert this kashaya to Shira Kashaya and give Kshira Bala or any nutritious food or nutritious mamsarasa or okra soup or Gandha Daila to rejuvenate her knees and daily Apinga or Pinda Daila or Bela Daila. If Vadarekta symptoms, she is having Vadarekta symptoms, these Panchamula Kashaya and Kashaya with Gulgulu or Sadavari Kashaya, these all can be selected.
Okay, ma'am. Ma'am, can you explain, ma'am, when to give 101 bala, 101 bala, kshir bala, and when to give ganda tela? I will get confused, and dhanvantar tela.
Okay.
This I will get confused always.
Bella Taila, Shira Bella Taila, you can use Shira Bella Taila in Avaranavada cases. You can use this Gandha Taila in osteoarthritic cases.
Okay, ma'am. And ma'am, dhanvantar tel?
Dhanvantara Taila is used for Sutta Vada diseases, and Kshira Bella is used or practiced for Vada Rekta or Avarana conditions.
Okay, ma'am. Thank you, ma'am.
Thank
And
you.
ma'am, one more case I have. One lady, menopause stage. She has a pain when she get up. That time she had a hand joint pain. No swelling, only pain. Stiffness is there. And when I took her history, her hetu was like ruksha ahar, means like her husband is diabetic. So she used to whatever he is taking, she is taking, but she is very lean. So it's like a vata prakopjanya, like dhatukshayjanya. So I am getting confused why this morning stiffness is coming in, means amalakshana, and but her hetu is dhatukshayjanya. So I am confusing what to give her uh, this pain relief,
Morning.
and she has all most of the symptoms are vata pitta janya, because she has nidra nash also, headache also, vertigo also. With that she had this joint pain, only hand joint pain, no other joint pain.
Post-menopausal stage, the lady is remaining in Vata Pitta stage. She is taking Ruksha Aharas. These may lead to Vata Prakopa itself, but the lady is in Vata Pitta state. In this state, there is chances of this OA chances is there. Extensive, she is having only pain of hand. Extensive, if she is doing extensive work or any other reason for supply or conduction of the hand, that should be evaluated. Then you please give this Mamsarasa or Thara or Abhinga any. Do not think about this Samprati. If it is the state is Vadapita and the disease is in Vada state. Evaluate for any pitta predominance. Use Pinnadaila Abhinga, Pinnadaila Thara, Madrashadi Kashaya, Munuji Sattva. This will help to diminish the symptoms.
Okay, ma'am. Thank you so much, ma'am. Thanks a lot, ma'am. Such a nice, wonderful lecture you have given. Thank you, ma'am.
Okay, thank you.
Yes, Dr. Jyoti.
Yes, ma'am. As you told, Mausarasa, some patients are vegetarian. So, what is the option if patients are vegetarian rather than Mausarasa? What can be given, ma'am?
You can give okra soup. In Malayalam, Vendakya. Okra,
Yes.
okra soup. And this Parushaga lehya, I have told Parushaga mixed with the ghee and this sugar. This should be kept in a container in a layering manner, and the joint should be lay a cloth over it to prevent the Krida centering in it. You please keep it in
Hello, ma'am. Voice is breaking, ma'am.
rice box, or in a heap of paddy for 21 days and give this parushaga or days along with this Please take half kilo of Parushaga, half kilo of krida, pure krida, and half kilo sugar. It will be keep in a glass container in a layering manner, and the lid should be tightened.
I think there is some internet issues over there.
Yes, ma'am. Okay, ma'am.
Okay, doctor. I think we can
Final
conclude.
section.
Yes, we can conclude. And if there is any doubt, you can ask in the next session. Okay. So the time is also over. Okay. Thank you all.
Thank you.
Okay. If there is any feedback, you can share. Okay. Okay.
Yes, please share the feedbacks. Anyone who wish to tell us the feedback? Yes, Jyoti. Yes, you can unmute.
Ma'am, thank you for arranging this session. It was more over practical and the preparations and some internal treatments also. And very nicely, ma'am had explained. So we can use to in our day-to-day practice. Thank you, ma'am.
Okay, thank you, Dr. Jyoti. Anyone else who wish to give us feedback? Okay, so we'll, yes, Dr. Vaidya Vishnath. Yes.
Yes, ma'am. It was a wonderful session, a practical oriented session. This is really informative. So usually we listen theory everywhere. The practical orientation is very important. The madam was explained very well. Thank you so much.
Thank you, Doctor. So we'll wind up the session here. So we'll come up again with another wonderful session day after tomorrow. That session will also be dealt by Dr. Rati ma'am. So we'll see you on 14th. Till then, take care and good night.